Now, Myanmar has reported its first 2 cases of COVID-19 after weeks of saying it's virus-free. Both cases are imported. Investigations are now underway into close contacts, while medical experts are calling for tougher prevention measures. Wai Kit joins us live for more on this. Wai Kit, tell us more about these 2 patients.
Well, Steve, for now, these 2 patients are said to be recovering and they're in isolation. Now, I want to touch a little bit about when they came into Myanmar, because this will give you a sense of just what the authorities are dealing with. The man who came in from UK came in days after Myanmar restricted travel restrictions in the country, and that was why when he came to Myanmar, although he had no COVID-19 symptoms, he had to be quarantined, and that was when the authorities found that he had the virus. So it was all contained within 1 day. The man who traveled from the US came before Myanmar rolled out travel restrictions, so he came in on March 13, which means for 10 days, before yesterday's announcement, that man had been able to freely and legally roam around the country. This gives you a sense of the challenges that the authorities will face when contact tracing, because now there are 2 cases and they are not centralized. One is in Yangon, central part of Myanmar, and one is in Chin State, which is in the northwest of the country.
What are some of the restrictions Myanmar has put in place so far then?
Myanmar has rolled out its strictest travel restrictions by far from March 25th. Myanmar nationals, regardless of where they're flying in from, when they return to the country, they will have to serve a 14-day quarantine in a facility that's designated by the government. And that is quite timely because this is very near the Myanmar New Year, between April 13 and April 18. That's when people choose to come back to the country. So with this travel restriction, it's likely to deter people from coming back. The other restriction is for foreigners, and that's even tougher to achieve, because before foreigners can even get on the plane to fly into Myanmar, they have to produce a certificate to say that they are COVID-19 free, which means to say they need to have access to laboratory facilities, which in other countries is quite likely to reserve this testing for suspected cases.
Why could other countries around the region have been dealing with COVID-19 for a while now? This is the first 2 cases in Myanmar. What are sentiments like on the ground now, and how are citizens reacting to this news of the 2 cases?
Well, as you can imagine, there is a wave of panic buying, but that's not unique to Myanmar, because we've seen such phenomena in other parts of the world, other parts of the city. What I want to point out would be 2 very subtle, very not so obvious aspects that is going to be a challenge for the authorities when dealing with COVID-19. One, social distancing. Myanmar people are known to be very hospitable, very warm people, so when they're out on the streets with their friends and family, they walk very close to one another. There's always body contact, and even when they speak to strangers, there is that closeness. So that's going to be very important to bear in mind. The second thing is Myanmar people's habit of chewing betel leaves, and you know when you chew betel leaves, you have to throw away, you have to spit the juice out from your mouth. So when you're dealing with COVID-19, this is going to be a very potentially challenging problem for the authorities.
All right, many thanks for that. Wai Kit keeping an eye on events in Myanmar.